Okay, well, good afternoon. Mayor Joe McComb. We'll get today's COVID briefing underway for December the 8th. Again, we want to thank everyone for paying attention to the reports and hopefully to the protocols to keep us safe. The numbers are still way too high, but relatively speaking, looking around the country, I guess you always try to see if you're better than someplace else. I think we're a lot better than a lot of places, but we want to be the best, and zero is the best, and so that's what we want to shoot for. Annette Rodriguez will be coming and give us some information. She gave us a wonderful report today during the city council meeting and an update on the vaccines and the schedules and the preparation for the administration of it and the protocols and priorities. One of the things that I've gotten several emails, and it looks like it's an organized effort to communicate with elected officials, or at least to the mayor's office. Please, 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 is what they're saying, do not make the vaccines mandatory. To my knowledge, the vaccines are not mandatory. I don't know that that's ever even come down from the federal government or the state government. It certainly hasn't even been discussed in the local government, county and city. This is going to be a voluntary program, and so if you get something like that, there's no discussion in any official circles that I'm aware of for mandatory requirements of vaccines. But, you know, things change, but I'm not anticipating that. I certainly, personally, would not support that, but I would certainly encourage people to get them when the vaccines are available for whatever category you may fall into, whether you're a medical provider, a first responder, in a residence where they're available, and then just the general public. So we'll follow that closely and keep you informed if we hear of any other changes. But at this time, I'd like to call on Annette to come and give her report and give us an update.
Quiero agradecer a todos los residentes que han hecho de su parte por evitar más contagios. Las cifras, aunque continúan altas, estamos mucho mejor que en otras ciudades del país. Es importante clarificar que en cuanto a la vacuna contra el COVID, esta no va a ser obligatoria, así que no se anticipa que las personas deban vacunarse si no lo quieren hacer. Ahora nos va a dar su reporte la directora del Distrito de Salud, Annette Rodríguez.
This here or no? Leave it there?
Annette Rodriguez, Public Health Director. We're going to go ahead and get started with the COVID-19 statistics today. First slide, please. So this is the last 2 weeks, and if you look at the number of cases here in Nueces County, November 25th, on the very far side, 184, then 121, and then it dropped into double digits. And then on November 29th, we went right back up to 233. And then we've stayed below 200 for the rest of the following days. So I could tell the community is trying, and I do appreciate that very much. Everybody here does, the hospitals as well, so thank you all for that. Next slide, please. So the donut diagram basically shows that there are 22,984 people recovered from COVID-19 in Nueces County. That's from the total of 25,612 cases. So that leaves active cases at 2,125 people that still have COVID-19 in our community, and they can still spread that virus to others. That's a real important number because a month ago we were at 200, 300 active cases, and now we're at 2,000. We have had over 500 deaths here in Nueces County. Next slide, please. For the hospitalizations, we started out 2 weeks ago at around 122 patients that were hospitalized with COVID-19. And then for today, we have 124 cases. It's been higher than lower, and so we're doing our best as a community to try to keep people from actually getting infected with coronavirus and actually having to be hospitalized with COVID-19. Next slide, please. These are the ICU cases. These are COVID-19 patients that have to be moved into intensive care because they need more attention than just the regular hospitalized patients. So if you look at 2 weeks ago on November 25th on the far right, we had 39 ICU patients. And again, today we have 39 ICU patients. And we've seen it go up to 44, and then we've seen it kind of stay at the high 30s, and now again, we're still at 39. Those numbers can move very quickly up. We also know that individuals don't always make it. We will have individuals that die from COVID-19. And so we really want to do everything in our power to keep people from getting this virus. Next slide. Total deaths for Nueces County, 503 as of today. We did have a death today, a male in his 60s with comorbidities, both diabetes and hypertension, high blood pressure. And so that's very concerning to lose somebody in their 60s. You know, we have a high majority of individuals that have both diabetes and high blood pressure. That doesn't mean that we normally lose individuals because of that. And so COVID-19 can be very devastating. We do wish our deepest condolences to the family that lost their family member to COVID-19 today. Next slide. And so these are the total fatalities. If you look at for the last 2 weeks, you see the numbers continue. They are in their single digits, 2 and then 5, 1, 3, 4, 2. We had 0 on December 1st, but then we had 4, and then today we had 1. I think that concludes our slides for today. So I'm going to switch hats a little bit, and I'm going to talk about what's going on at the health district with COVID-19 cases, as well as vaccine that looks like it's going to be rolling out here very soon. So the health district did have a drive-through this morning. A total of 61 individuals were tested, and 16 of those came back positive for a positivity rate of 26%. Our next drive-through is scheduled Saturday, December 12th at 7:30 in the morning. You can self-register at www.cctexas.com and just click on the register for drive-through. We have received a lot of questions regarding COVID-19 vaccines and when they will be here. We are monitoring the vaccine that was approved for emergency use authorization in the UK, and we are confident that we will be receiving similar exciting news soon. The health district participates on weekly conferences with the Department of State Health Services regarding COVID-19 vaccine. The information provided to us at these calls allows us to prepare to receive COVID-19 vaccine for mass distribution. The plan for vaccine distribution continues to be scheduled on a phased approach. This method was recommended and approved by what's called an expert vaccine allocation panel. They call it EVAP. It was created by the Department of State Health Services, and this panel reports to Dr. John Hellerstadt, the Commissioner of Health for the state of Texas, who makes the final decision on who is vaccinated in which tier. The recommendation is based on principles that protect healthcare, frontline, and vulnerable populations, as well as through the recognition of health inequities, current scientific data, geographic diversity, and as always, transparency. 2 vaccine candidates are currently scheduled to go for FDA authorization. Those are Pfizer and Moderna. Pfizer is scheduled to be reviewed on December 10th by the FDA, and Moderna on the 17th. The tentative date, if approved, for COVID-19 vaccines to be rolled out across Texas is the week of December 14th. which is next week. This date is, of course, dependent on FDA approval. As mentioned, vaccination distribution will be through a phased approach. At this time, Phase 1A, Tier 1, includes hospital staff, long-term care staff, EMS, home health care workers, residents of long-term care facilities, as well as healthcare workers working in hospice and with vulnerable populations. As the phases continue, vaccine supply availability will increase and distribution will expand, allowing for increased access to the vaccine across larger populations. And of course, as the mayor mentioned, this is all voluntary. For this effort, we will be employing a drive-through mechanism similar to how we operate our COVID-19 testing drive-through. 2 of the locations we are currently looking at for potential distribution sites are the Richard Borchard Fairgrounds, the Greyhound racetracks, and of course, we're also looking at other venues. Vaccine distribution will also occur through other vaccine providers throughout Nueces County, not only the health district. If you are a provider, if you are a medical physician who still has not registered for COVID-19 vaccine distribution, call the DSHS COVID-19 vaccine provider hotline at 877-835-7750, Monday through Friday between 8 and 5. Alternatively, you can also visit our website at cctexas.com/coronavirus for the link on how to sign up to become a COVID-19 vaccine provider. Finally, although the vaccine is just around the corner, and we are very excited again to finally get to this point, COVID-19 is still amongst us and will be here until we have herd immunity in our community. That means, herd immunity means at least 70% of the population has either been vaccinated and has some type of protection, or you've actually gotten coronavirus in 70 or more percent of the population. So until then, the health district advises, do not let your guard down. Christmas and New Year are around the corner, and public health is going to thank you for following the request during Thanksgiving and keeping it down to just family members. But we're also going to ask you to consider small, immediate, family member only Christmas and New Year celebrations. Some activities, as we all know, are more risky than others. So please consider the following. For low-risk activities during the holidays, celebrating at home with members of your household are low risk. Viewing holiday lights with your family only in your car are low risk. Having a family dinner with household members only is low risk. For moderate risk, attending outdoor public tree lighting ceremonies or activities is a moderate risk activity. Taking photos with Santa is a moderate risk. Attending a holiday parade is also a moderate risk. For high-risk activities, that's attending a large indoor gathering with singing and a lot of activities. Also high risk is celebrating New Year's Eve at a bar. Also attending a Super Bowl party with others outside of your household is considered a high-risk activity. So please continue to practice the 3 W's and wear a mask, wash your hands, and watch your distance. Stay healthy and continue to stay informed on COVID-19 cases. Thank you.
El día de hoy se reportan 110 casos positivos al coronavirus. 2.125 casos aún están activos. 22.984 se han recuperado. 503 personas han fallecido a la fecha, incluida una persona el día de hoy. 124 personas se encuentran actualmente en el hospital. De estas, 39 se encuentran en la unidad de cuidados intensivos. El día de hoy se analizaron 61 muestras, 16 de ellas dieron positivo. Si usted tiene síntomas y desea registrarse, acuda al portal www.cctexas.com/coronavirus. Hemos recibido muchas preguntas sobre las vacunas COVID-19 y cuándo estarán aquí. El plan de distribución de vacunas continúa programado por etapas. Actualmente están programadas para la autorización de la FDA 2 vacunas candidatas, Pfizer y Moderna. La fecha tentativa, si se aprueba para la implementación de las vacunas COVID-19 en Texas, es la semana del 14 de diciembre. Como se mencionó, la distribución de la vacunación se realizará mediante etapas. La fase 1A incluye el personal del hospital, el personal de atención a largo plazo, los servicios médicos de emergencia, los trabajadores de atención médica a domicilio, los residentes de instalaciones de atención a largo plazo, así como los trabajadores de atención médica que trabajan en hospicios y con poblaciones vulnerables. A medida que continúen las fases, la disponibilidad del suministro de vacunas aumentará y la distribución se expandirá. Dos de las ubicaciones que estamos buscando actualmente para posibles sitios de distribución son el Centro de Exposiciones Richard Borchardt en Robstown, el Galgódromo Greyhound y otros lugares. Si usted es un proveedor que aún no se ha registrado para la distribución de la vacuna, llame a la línea directa de proveedores de vacuna COVID-19 del Departamento de Salud del Estado al número 877-835-7750. Le pedimos que sea considerado durante las celebraciones de Navidad y Año Nuevo y considere lo siguiente. Entre las acciones de bajo riesgo de contagio existen celebrar en casa con miembros de su hogar, ver las luces navideñas con su familia solo desde su automóvil, tener una cena familiar solo con miembros directos de su hogar. Las acciones de riesgo moderado es asistir a actividades de iluminación de árboles públicos al aire libre, tomarse fotos con Santa y asistir a un desfile festivo. Y las actividades de alto riesgo, asistir a una gran reunión en el interior con actividades, celebración de Nochevieja en un bar, asistir a una vieja del Super Bowl con otras personas fuera de su hogar, por lo que se le pide continuar practicando las recomendaciones de salubridad. A continuación, el reporte del Dr. Chris Bird por parte de la Universidad Texas A&M.
Good evening, everybody. My name is Dr. Chris Bird. I'm here on behalf of the Coastal Bend COVID Task Force. Judge Canales wants to let you know that she's sorry she can't be here. She's otherwise indisposed, but I know what she wants you to know is that at Nueces Knows you can find information on how to celebrate the holiday season. So make sure you check out nuecesknows.com. Is that right? Can I get a confirmation? Yep, .com, nuecesknows.com. So check that out. All right, here on the task force, we have two objectives. One is to address public concerns and questions about COVID-19 and the interventions that are taking place to address the pandemic. And two, to help enable evidence-based decision-making by leaders here in the Coastal Bend community. So there are several interventions that are in place. You're urged to stay at home if you can. Face coverings and social distancing are still mandated. Isolate when you're exposed to COVID-19 or symptomatic, even if you think you don't have COVID and you have a runny nose or something. The best thing to do is to self-isolate, contact your doctor, and go from there. We have partially remote schooling, and we're at Open Texas Phase 3, which means that businesses are at 75% capacity in general, and bars are at 50% operating capacity right now. In the Coastal Bend, we're up to 28,661 confirmed COVID cases. In the Coastal Bend, 25,410 recoveries. You can see that this cumulative total is turning upwards. So, we're going through an outbreak right now, the fall / winter outbreak. It looks like it might be spreading into the winter. And we're at 2,477 active cases in the Coastal Bend. And that's not much more than last week. And if you look at the graph really closely below the word cases, you can see that it's leveled off a little bit. But we do expect that that's going to change. And that leveling was maybe caused by Thanksgiving and associated activities. So you've been seeing the brown projection that's on the screen for the last month and a half. And that projection held true up until today. And we're releasing a new projection, updating that. In the past, I showed you what might happen if over Thanksgiving we celebrated it normally, and it would result in a lot more cases. And I asked you guys to prove me wrong, and you did. So it looks like not only did we not all celebrate Thanksgiving normally, it looks like more or less there was a lull in COVID and the spread of COVID. It looks like the transmission rate went below 1 for about a week, starting a week before Thanksgiving and ending at the end of Thanksgiving Day. And when we determined that by fitting the model to the cases, to the new cases that we see in the Coastal Bend area. And so that new model projection is the orange line. It's a little hard for me to see on the screen here, but it's the one that's lower with a peak that's farther into the future. This results in our projection of the transition from 75% capacity to 50% capacity for businesses, which is mandated by state regulation, will occur a week later on December 21st right now. And we'll keep you appraised at that. Usually when we see changes in the transmission rate like this, it takes us a few days or maybe even a week to get it dialed in right. So expect maybe a few more tweaks to this projection. But the important part is that the new projection indicates that the peak is going to be lower. And so that would be a direct result of more vigilance, less transmission of COVID leading up to Thanksgiving, which is a good sign. If we look at the coastal bend, at the 12 different counties, you can see that Nueces has the most cases, and it's starting to turn upwards again after that Thanksgiving lull. San Patricio only reports their positive cases on Fridays, so that uptick is because we're pretty close to last Friday, and realize that's a whole week's worth of cases that are getting reported there. And then the other counties in the coastal bend are well below the levels of Nueces. Looking at the positive testing rate, I don't have the data that the Director Rodriguez was talking about earlier, but our estimated percentage positives is remarkably close to what they observed today, at about 28% on average, so maybe round that down to 27% on average after factoring in today's results, whereas the mobile testing is about a 10% positive rate. Now, why are these so different? Well, it's possible that very different people are being sampled by mobile testing versus the public health department testing. And there's no way to really have a perfect sampling of the community. Both numbers are valid, and if you want to know an overall percentage positive result, somewhere between 10 and 28%. We started a social media account in the past 2 weeks, CB COVID, and I've seen some people really want to know the percent positives. Being somebody that's very skeptical and has been looking at the numbers a lot over the past 9 months, percent positives don't tell you all that much, but we'll keep showing this. The cases is really where it's at. Okay, moving forward, for the inpatients, this is one of the reasons why we're really concerned. We don't want our hospitals to get overloaded. With the new projection, which is the lower peak that's farther in the future, it looks like we're not going to stress the hospital system as much as originally projected because of that pre-Thanksgiving lull that I was talking about earlier. So let's hope that that continues. And I just want to let you know that we do not fit these lines to the hospital data. This result of the model projecting the hospitalizations is based upon a fit to the cases. So this is the model matching very accurately the hospitalizations pattern that we saw, which is why we're pretty sure that there was an actual Thanksgiving lull, because it's consistent across cases and hospitalizations. Now, what we're really concerned about also with this transition from 75% business capacity to 50% is the percentage of staffed beds that are filled with COVID patients. And right now, that's at about 9.7%. When this number goes to 15% for 7 days in a row, that's when, by state mandate, we transition from 75% business capacity and 50% bar capacity to bars closed and 50% business capacity. We want to try to avoid hitting this, but the projections indicate that we're not going to be able to avoid it. You can see, again, that pre-Thanksgiving lull that occurred there, and it kind of kept us right below 10%, but we're expecting that this is going to start rising, and you'll know if we're on track with the projection if this number hits 15% on December 14th. Because we're projecting that by the 21st, that would be when we transition from 75% to 50% capacity. So we're going to keep an eye on that. And we're really concerned about the people in the ICU. We want to make sure that the ICU doesn't get really stressed like it did in the summer outbreak. Right now, we're at 45 patients in the coastal bend that are COVID positive in the ICU. And that's somewhere around 30% of all the patients. You could run the numbers there. I didn't calculate it exactly, but that's been about the percentage range that we're in right now. And you can see that over the past week, it's kind of gone down. And if you get really zoomed in, it's starting to go up a little bit. But if you zoom out, you can see a longer-term pattern of a general increase that's occurring there. For the people that aren't in the room, if you look above the word COVID and go from the C to the D, you can see that the red is just going up. And we expect that that upwards trend is going to continue. And rounding out with the fatalities, this is the projection again. We think there's going to be fewer fatalities than originally projected due to that Thanksgiving lull. There is an uptick of fatalities occurring, and there will be some level of fatalities that we can't control because there's such a lag between when people test positive and when mortality occurs for those that are so unfortunate. But overall, it looks like we're not going to reach the same levels that were originally projected. Now, I'll take this opportunity to say that these projections are dependent upon when we transition to 50% business capacity that we respond, the same way that we did in the summer when we transitioned from 75% to 50% business capacity, which we really did quite remarkably. From July 3rd to July 10th, we bent the transmission rate from 3 to 0.9. And we're hoping for a similar bend in that transmission rate, not as extreme, but back to 0.9 1 week after that transition of businesses going to 50%. If that occurs, then the projection will hold true. But if we have pandemic fatigue and we decide, well, we're tired of, trying to stop the transmission of COVID, then the peak could go higher, or the peak could go lower, depending on how we respond. So really, that's up to us, and that's the next place where we have a lot of uncertainty. Right, and so far there's been 774 people that have died from COVID-19 in the Coastal Bend. These aren't people that died tangentially due to COVID. These are people where the primary cause of death on their death certificate is COVID-19. This data is processed by the state, and as such, it's about 14 days behind because it takes about 14 days for them to process all the death certificates. If you look at the upper left-hand corner, the inset graph shows the daily fatalities that's occurring, and the purple curve is Nueces. The other lines are for the other counties in the Coastal Bend, and you can see that we're ticking upwards in the average new cases per day. Or sorry, not new cases, new fatalities per day. Okay, moving on to cell phone data. We use the cell phone data to try to predict what's going to happen in the future because cell phone data might be more indicative of what's happening pretty close to now when you get infected to 5 days later when you might become symptomatic, and then a few days after that when you might get tested and get the results, maybe after 10 days of getting infected. You can see how there's delays built into this. So the cell phone data can tell us interesting things. We look at foot traffic, the proportion of people leaving home, encounters between different cell phones. And one thing that's very clear in the data is that there was a big spike on Black Friday. It wasn't a Thanksgiving spike in activity. It was the day after Thanksgiving when everybody wants to go out and do their Christmas shopping and all the sales that are around then. So there was a big Black Friday spike in mobility. There was a big Black Friday spike in people going to the movies. There was a big spike in people going to the malls. There was a big spike in people going to restaurants. There was a Black Friday spike pretty much all around that wasn't as high into the weekend, but still continued throughout the weekend. That being said, the encounters were still relatively low, which maybe indicates that people are doing more than we were before earlier in the pandemic to try to keep our distance from other people. All right, some visualizations from the cell phone data that we'll show. This map shows where people came from to the Coastal Bend in Texas over the Thanksgiving holiday and that week-long period. The graph has some associated time points. The blue is Memorial Day. The red is during the huge June surge when we were at a transmission rate of 3. The white is the 4th of July, and then the orange are the weeks leading up to Thanksgiving, and then the last orange bar is the one that includes Thanksgiving. What you can see is that there was a lot less traffic coming into the Coastal Bend for Thanksgiving than these other milestone holidays and high points in terms of travel to the Coastal Bend. So that's sort of a positive Overall, travel to the coastal bend is down 20%, or it's not travel to the coastal bend, it's visits to restaurants. We're down 20% overall in this year versus last year. You could probably chalk most of that up to the 75% capacity regulation that's in place right now. Things like malls, they were at 100% of the same traffic that we saw last year, and things like that. Malls don't necessarily have explicitly that same policy to adhere to, or they're maybe not hitting that 75% level. So when we look at weekend travel by coastal benders, I'm not sure if that's the right term, but that's the only one that I could come up with. So travel by locals here in the coastal bend to other places in the coastal bend, which you can see right there next to the CB COVID logo, where it's hot red. There's a lot of visits within the coastal bend, but also from the coastal bend to many other parts of the 48 contiguous United States, including San Antonio, the #1 destination outside of the coastal bend, followed up by Austin, and then that area over between Arizona and New Mexico, that's also pretty hot, and then the rest of the country is pretty well spread out. But what we're showing here is that people from the coastal bend traveled all over the country for Thanksgiving and that weekend, and now they're probably going to be coming back at some point, and that's something that we want to be aware of. This is a 29% increase over the previous week, so we did see that increased holiday travel, but nonetheless, it didn't seem to be enough to really cause a huge spike in our cases from what it looks like. So in summary, we're in the middle of a fall outbreak, and it looks like it's going to make it all the way to being a winter outbreak also before the peak. We expect that there will be intervention on the 21st of December where businesses go to 50% capacity and bars close. We'll keep you updated on that projection when we think that's going to occur. New cases and hospitalizations have resumed increasing, and the Thanksgiving lull ended on Black Friday. It started the week before Thanksgiving. It went right up to and including Thanksgiving, and then it's very clear from the cell phone data that it was over on Black Friday, and from there forward, we probably went back to even more activity than what was normal, but I suspect that after that weekend, we've gone back down to normal levels of activity that aren't being affected by Thanksgiving anymore. And it's important to keep in mind that fatalities are rising. We expect these to continue to rise because they're being affected by processes that are happening well before Thanksgiving. And lastly, I want to remind everybody that this is the last live presentation that's planned right now for the task force. We will pre-record future reports. I believe that they'll still be distributed on CC Texas, as well as at our social media sites on Facebook, Twitter, YouTube, and Instagram. At CB COVID is our handle. We're going to update social media with posts of particular graphs that we think are interesting throughout the week. So you don't have to wait a week or sit through a half an hour lecture on the particular information that you're interested in getting. And lastly, we're going to continue to do the live question and answer sessions, which we think is the really important thing, to continue to allow the Coastal Bend to ask questions, and we try to answer them as best we could. We did that last Friday with Public Health Director Annette Rodriguez and myself, and we're going to do that again this Friday at noon on Facebook Live and YouTube also. And if you can't be there at noon, we also post those recordings on social media for you to find later on. So with that, I want to thank you and everybody that's contributed to the task force. It's really a large group. And we'll go to a translation and then field some questions from Facebook Live.
El área de la costa reporta a la fecha 28.661 casos confirmados por el coronavirus. De esa cifra, 25.410 personas se han recuperado. Actualmente existen 2.477 casos activos. De acuerdo a estas cifras, el radio de transmisión declinó durante la semana previa al Día de Acción de Gracias. En los últimos 4 días, el porcentaje de pacientes infectados con el virus es de 9.7%, mientras que los pacientes que se encuentran en la unidad de cuidados intensivos declinó un poco la semana pasada. Actualmente son 45 los pacientes que se encuentran en esa unidad. El número de decesos continúa en aumento, pero la proyección ha disminuido y se estiman menores decesos. Actualmente, esa cifra se encuentra en 774 personas. El condado de Nueces continúa siendo el condado con el mayor número de casos en el área de la costa. Se estima que los visitantes a los restaurantes también disminuyó en un 20%, esto en cuanto a visitantes provenientes de otras ciudades hacia nuestra región. En cuanto a residentes del área de la costa que visitaron a diferentes ciudades en toda la nación, las ciudades preferidas son San Antonio y Austin. Se estima que este nuevo brote o segunda ola de casos va a continuar hasta finales del mes. Les recordamos que el reporte de la universidad ya no se va a dar aquí en vivo en la conferencia del martes, sino mediante las redes sociales en Facebook, Twitter, Instagram y YouTube, en su handle @cbcovid. En vivo va a haber una sesión de preguntas y respuestas los viernes en Facebook Live al mediodía.
Will there be enough vaccines for the second dose, considering it has to be 21 days apart?
Yeah, that's a great question. So the question is, will there be enough vaccine for the second dose? Since for Pfizer, you have to have 2 doses to be considered vaccinated, and they're 21 days apart. And the answer is yes. CDC is actually doing something phenomenal for the states, and that is that they're holding back that second dose. So if they were going to give us, like they gave us 6,000 for the hospitals, they actually had 12,000 available for them, but they're holding the other 6,000 that they're going to distribute on the 21st. Mm-hmm.
Another one about death certificates. Let's see. So the deaths that list COVID in part 1 of the death certificate, did the CDC not direct us to use COVID in parts 1 and 2? The death certificate.
I'm not sure if CDC directed, but DSHS, the Department of State Health Services for the state of Texas, did direct that we would only use Part 1. So if it has anything that's COVID-related in Part 1 and there's an A, B, C, D, then it counts as a COVID-related death. If it's in the bottom part, in Part B, then no, we do not count that as a COVID-related death.
Can I ask for clarification on that? Was the question about were medical professionals directed to fill out a certain portion of the form, or was it a question about which portion of the form counts as a COVID-related fatality?
I'll just repeat it.
Okay.
Did you say the deaths all list COVID in part 1 of the death certificate? And the second part of the question, did the CDC not direct us to use COVID in parts 1 and 2?
Yeah, so I think the director answered that exactly right. And the deaths that we see are from part 1. COVID was listed in part 1 of the death certificate.
Thank you. Can you talk about the ruling the governor made regarding the 15% COVID hospitalizations and businesses?
So the 15%
Guidelines.
capacity? So basically, the governor said that if your hospital capacity reaches 15% or greater for 7 days straight, then you would roll back Texas, So if you're at 75% like we currently are, then you may end up rolling back to 50% at that point. So we are not at 15% at this point, but we are still watching those numbers very carefully.
Right, and that's not for any one hospital. It's for a whole trauma service area, of which the Coastal Bend is a complete trauma service area. So that's why we're reporting for the whole Coastal Bend, and that rule applies to the whole Coastal Bend area. And it has to be 15% positive. 15% of the staffed beds having COVID patients in them for 7 days in a row to trigger that rollback.
So consecutive, not average, of 7 days?
Consecutive.
Not average. So if you have 6 days and then it goes below 15%, it resets.
Thank you. What is the rate of infection currently? Do you know? Transmission rate?
The transmission rate right now is about 1.35. So for every one person that gets infected with COVID, they're transmitting it to 1 to 2 people on average, but more likely 1 than 2, which results in the 1.35.
Okay. Just to repeat the first question that I asked, since now the mic is on. It was, will there be enough vaccines for the second dose, considering it has to be 21 days apart, which you already answered. But
Yes, yes.
I think that's all I've got. Anybody else?
Thank you.
Thank you.
Hello. We've heard that the health district has stopped immunizations to prepare for COVID-19 vaccinations. When does the county expect to start up again?
For immunizations,
For
are you
immunizations.
are you
yeah.
talking about like childhood immunizations or flu vaccines?
Yeah,
or-
so all those immunizations,
Okay,
just like the
okay.
regular ones.
Right, and so we haven't had, certain services have been minimalized because we have been doing swabbing testing, and now we're preparing for COVID-19 vaccine mass distribution. And so as soon as we get to a point where it slows down a little, because our priority is definitely to try to get this pandemic behind us and to vaccinate as much of the community that will have us, vaccinate them. After we get past that point, then we will go back to doing that. We are also not considered the medical providers for the community. The push has really been that people receive their own providers, which means that they get a doctor, a pediatrician, a physician that actually can vaccinate them on an annual basis.
Thank you. And we had someone in the medical program ask how this will impact them.
How,
As far as not getting immunizations because they're stopping that to prepare for the COVID-19 vaccinations.
well, again, there are a lot of other venues where they can get their vaccine. The pediatrician's offices are still open and they can vaccinate, and so that's where they should be getting vaccinations. So it shouldn't impact anybody in a negative way because there are other venues for receiving your vaccine.
Thank you. And hospitalization ICU numbers have dropped. Could that be contributed to the recent delivery of the therapeutic drugs, such as Eli Lilly's antibody that arrived in Texas on November 19th?
It definitely could. I'm hopeful that that is the case. We received 38 doses that first week, and then the following week we received 24 doses. And so hopefully the individuals received those therapeutics early on, so they never ended up in the hospital, because these are not for treatment for hospitalized patients. These are for outpatient treatment only.
Thank you. What would be your response if the city were to hold or host any holiday events, even if they were outside?
If they were to hold what?
Any holiday events?
I think we have to be role models. I think we have to be leaders. And I think that if you're going to be hosting a party where you have large number of people, even if it's outdoors, people tend to kind of congregate together. So I don't think it would be in our best interest to do that, especially right now where we are in the pandemic.
And any additional recommendations for people to stay safe during this pandemic?
I think one that we forget to mention and needs mentioning is that if you have COVID-19 people that live in your household that are sick, you should be opening those windows to get some outside air inside, kind of move that air around. And also just do your best to stay as distant as you can from strangers so that you don't pick up COVID-19. I think people forget that, that they don't have any immunity to COVID-19 and they just are ready to go back to some sense of normalcy, and we're not quite there yet.
Thank you.
You're welcome. Seeing no other questions, thank you very much. And we will have a press briefing next Tuesday. So it'll be the mayor as well as the judge and myself. So on a regular basis as needed. So next Tuesday. Again, thank you all so much, and we'll see you then. Good night.